Welcome to the Flash Forum on Managing Business Disruption and Supply Chain Risk. My name is Lou Roberts. I am adjunct faculty at the Gordon Institute of Business Science and lecturer and consultant at Georgia Tech. Today, I'd like to welcome Dr. Julie Swann, who is a colleague of mine who I've known for quite a few years, and she's going to be leading the lecture today. Dr. Swann was the director of the Health and Humanitarian Logistics Program and Center at Georgia Tech, and is currently the department head of the Industrial and Systems Engineering Department at North Carolina State University. I'm going to be handing over to Dr. Swann, and just a few words on the sequence of the way we're going to do this afternoon, or this morning, or depending on where you are, Dr. Swann is going to introduce herself and take you through the first 20 minutes of the lecture. She's going to talk about pandemics and how pandemics spread, communities and so on, some of the models. We're going to then have, that'll take 20 minutes or so, then we'll have about 10 minutes for Q&A. If you could please, in the chat section, post your questions, and then we'll field your questions for about 10 minutes. I'll then hand back to Dr. Swann. She will take us through the next 20 minutes or so, where she'll be talking about how pandemics affect supply chains, and especially medical supply chains, and then how pandemics and COVID-19 has impacted other types of business. And then we'll have another few minutes after that for Q&A. And again, I'll be fielding your questions. So with that, I'd like you to welcome Dr. Swann. Over to you. Thank you.
Thank you very much, Lou. I'm delighted to be with you here today from wherever you are. So as Lou mentioned, we'll be talking about disruptions in supply chains and continuity, especially in this age of COVID-19. And I want to talk a little bit about how we think about diseases. And the reason that I want to talk about this is that it lays the groundwork for thinking about supply chain continuity in the face of a major disease spread. It also helps us in interpreting the data and what we're hearing in the news, and in thinking about ways to protect ourselves and our workers in our business. So one of the classic kinds of disease models is called SEIR. So let me talk a little bit about what that is. So we start with an individual. Let's imagine that this is me, and I'm susceptible to a disease. I'm healthy otherwise, and I become exposed in some kind of fashion. And after being exposed, I may become infectious to others. And then there's a period of time during which I'm infectious, and hopefully I'll recover at the end of that time period. Now, for COVID-19, the exposure to infectious period is approximately 3 to 5 days, and usually people are infectious for about 2 weeks before they recover. But the disease model, there's a little bit more that we need to know. So for example, how infectious is the virus that causes COVID-19? One measure that we use is the average number of people infected by someone during their infectious period. And usually this is measured at the beginning of a disease outbreak before interventions are in place. And what we know about COVID-19 is that typically an individual would infect 2 to 3 others during the time period in which they're infectious. And in the absence of any distance or interventions, we would find that the number of cases would tend to double about every 6 days. And so that's a pretty important measure. What we also know is that means it's much more infectious than the flu, but not as infectious as measles, for example. Now, this picture that I'm showing you right now is still a little bit simplistic, so we need to go a little bit further to understand what that would mean in an individual. In fact, the infectious period of this picture can be broken up. We can have different kinds of infectivity. In fact, some people do not show symptoms when they're infectious, so we say that they are asymptomatic. We have others who are symptomatic, and some portion of those may need to be hospitalized. That's important because then they're using a critical resource like a bed in an intensive care unit or a critical care unit. And of course, not everyone recovers. For COVID-19, it's thought that of those who are exposed, up to 1% may die. But if we look at the fatality rates in the news, we would find that would be much higher because generally they're only taking that portion of people who are showing symptoms. Now, that portion of people who are asymptomatic is really important because that means that the disease can be spreading in our workplaces when people don't even know they have it. And so that's one reason that there are a number of interventions that are important for COVID-19. But this picture here is still for a specific person. So me, I'm healthy, and then I become exposed, infectious, recovered. But really, we need to think about this in the context of a larger community, whether that's our city, our country, or our workplace. So for that, we begin with a set of individuals across our network. And these are in different households of different sizes, of different ages, some of them with children. In addition to the household, we have several different pathways where someone could become infected. Certainly in the community is one example, in grocery stores and public gathering places, but there are also things like schools, and there are workplaces where adults may interact. And so if you start with someone who's infectious and then their household is at risk both for acquiring the disease and in passing it on to others in the workplace or in schools or the community. So this also tells us something about the different interventions that might be possible. So for example, we could ask households that have been exposed to the disease to isolate and quarantine. And so that removes that infected individual and its household from the larger community. We could close schools to try to prevent the spread between households. We could close workplaces and ask people to telecommute and have only essential work happening. And then we can have community interventions as well, where we say that we're not going to have mass gatherings for sports or places of worship or even for non-essential businesses. So this explains some of the different kinds of interventions that may be in place where you are or elsewhere. Now, as we look forward and think about the future and people who do disease modeling as well, there are a number of different pathways forward. So, but before I talk about the pathways forward, let's talk a little bit more about where we are now. So the picture on the left, taken from the website at the bottom, is showing that the confirmed cases of COVID and deaths continue to rise. I'll also point out that these are confirmed cases or deaths which have been confirmed with the test. Of course, people think that there are many other cases that we're not seeing, either because they're asymptomatic or because people have not been tested yet. If you look worldwide, this is hit across the world, of course, and with varying rates so far. And eventually, every country will be hit or has been already, and these rates will continue to go up over time. Another thing to look at is how quickly it's spreading in different environments. The table that I have on the right is talking about the doubling rate, and at present, how the number of confirmed cases or deaths are doubling. And there's several hotspots currently around Africa. And of course, this data would continue to change as different things happen in different places, interventions put in place, or gatherings or travel that might lead to more cases. As we look forward towards the future, a number of modelers have taken that information that I presented about how transmission happens, and they projected what might happen for the future. And this depends also on the actions that are taken. Now, within Africa, the following models are stratified by countries of different income levels. Actually, this picture is for countries from around the world, but there are also pictures that are specific to just Africa. And the lower income countries are on the left and the higher income on the right. And you can see here that there's some bars on the chart. And the one that's tallest is one without any interventions, without any mitigation measures. And then the other ones are a couple of different interventions in place, where you can see it decreases the cases in the population by a significant amount. And if you look at the projections for deaths and critical care, on the left-hand side, we see that the infection rate is pretty much the same in countries of different income levels. But on the right-hand side, it does look like the projections are suggesting that the death rate will be higher in higher income countries and lower in lower income countries. Although one important factor is that in lower income countries, the demand for critical care beds and the associated resources is expected to outstrip the supply by quite a lot. And there are some things that you can do to prepare in advance, but it's also about being aware that this may be coming and taking actions. And of course, as actions are taken, then these rates would decrease. As we look forward towards the future, there are a couple of things that could happen. One is that we know that a pandemic or a set of epidemics may stop when enough of the population has been infected already, and if they have some immunity to the disease. It's a pretty large number that you need for that to happen. Experts think that it's 60 to 80% of the population would have had to have had this particular disease. And there is even some question about whether immunity would be long lasting or whether it would be relatively short to medium term time frame. And if we do nothing, we also know that of those who are infected, perhaps 1% of them could die, and it can be more than that if there are critical resources such as hospital beds or ventilators that are in short supply. There are other things that we can do to address this. A number of countries and workplaces have put in place measures, including distancing measures to try to keep people apart from each other, protection for vulnerable populations, since we know that those who are older and have certain kinds of diseases are more likely to have severe outcomes, and then also balancing the economics of being out of work and what that means for the individuals as well as the society that economy is supporting. We are continuing to look towards innovation where new treatment could reduce mortality and could reduce hospital stays. And of course, countries and businesses around the world are racing to develop vaccines to prevent the disease, and after which global distribution would happen. And of course, we hope for all of these kinds of things. Now, in the next section, we'll be talking about supply chain risk. But before we go to that section, I'd like to pause and see if our moderator has anything to say at this point.
Yes, thanks very much, Julie. We have a couple of questions. One is, you had showed a slide that looked at different income levels. One of the things that we see in the US is a disproportionate number of people being affected by this disease. And one of the questions is around that sort of effect of the disease in those income groups. So is that being borne out from what you can see from the data in Africa that you know, due to perhaps lower income and harsher conditions, the population within Africa is suffering somewhat more than perhaps a population in Europe or the US?
That is a great question. And to answer that, let me first start with some of the factors that we know make someone at greater risk for severe outcomes. So age is one of those factors. So generally the guideline that a lot of the governmental organizations talk about is that people 60 and over are at greater risk than those who are below 60. That is not a hard and fast number. That's just an approximation. And that risk does grow as someone goes to 70 or 80 or 90. So when you look at Africa compared to some other parts of the world, the population is a little bit younger than in Italy, for example. And so that's one reason that the projection of the death rate is lower for some of the lower income countries than it is for some of the higher income countries. Now, there's some other factors as well. It's not just age. A second factor is disease conditions that make you more at risk for severe outcomes. And usually these diseases are things that are chronic, like diabetes, cardiovascular conditions, perhaps asthma or chronic obstructive pulmonary disease, which is associated with past smoking. Also potentially things like cancer or HIV, if that HIV is not under control. So when you look at the burden of disease in Africa, there's a higher burden for some of those types of diseases and a lower burden for others of those. And so that, I think, is balancing out when you look at the risks in Africa. The next layer that affects how this might hit perhaps lower income groups before higher income groups is what kind of contact individuals have with others in the network. So if someone is an essential worker, if they're working in a hospital, for example, or if they're working in grocery stores or in the trucking industry, then they are more likely to be in contact with members of the public and more likely to go to different places where there might be the disease spreading. And so people who are in that group are more likely to be affected. And that certainly is happening in the United States. And typically it's lower income workers who would be working in a grocery store, for example, and higher income workers are able to telecommute from home. And that's happened in Singapore as well, where the disease has spread through some of the migrant groups who are living in dormitories in crowded conditions. And then the fourth factor, and this was not taking into account in the results that I showed of the lead modelers from the United Kingdom, and that's sanitation. So certainly being able to have clean water, to be able to clean your hands would be another factor. And this is where I think that there are parts of Africa that would be at greater risk for the disease and for severe outcomes. In addition to that, one final factor is how connected societies are. So, certainly in the early days, there was a lot of spread of disease through travel in the airlines as people would go from one country to another. That's decreased right now. And I would expect that, more rural communities, if they can avoid being hit, then they may be better off. But if the disease does make it there, then of course, the outcomes in that location would be worse. So in general, I would expect that there would be greater impacts on lower income groups within a particular country. But it is complicated because there are a number of different factors that may come into play.
Thank you for that very good answer. I think that pertains to South Africa, certainly in other countries within Africa. You've got overcrowding in certain parts of the community where there's several people living under one roof, and especially not being able to go out very much. I think that situation exacerbated. And then also the fact that there is not necessarily, good conditions around running water and sanitation and so on. So that is of concern. I think especially in South Africa, I've heard that from some of my colleagues in the country. I have another question for you. One of the concerns, of course, obviously people are focused on this wave, this pandemic, and how that's affecting life in general and what's going to happen around that, and when can we go back to living as a semi-normal sort of a life, and when will that eventually taper off? But then the next question comes around, will there be a second wave, and how do we prepare for this? So I was just wondering if you had any thoughts on that.
That's another great question. You certainly see people talking about a second wave and what that means. There are a couple of different kinds of second waves, and let me dive into that just a little bit so that we're clear about which one. And when we look at past pandemics, especially the ones in the last 100 years, several of which were the worldwide ones were influenza based, we do see second waves, and we see second waves for a couple of reasons. One is that some diseases may die down based on the weather, the temperature, the humidity level, things like that, and possibly also the behavior of individuals and communities during different time periods of the year. Influenza is like that. So we know that influenza has different seasons. There's a higher season and a lower season. And when, you certainly can have a strain of influenza hit and pop up in that high season, and then it dies down in the low season, and then it comes back again. And so there certainly could be a second wave for that reason. Most experts right now think that there will not be a large change in transmission during the different months of the year for this particular coronavirus, that it's not quite as affected by temperature and humidity as we've seen for influenza. We'll still, pay attention to see what happens, because we don't entirely know there. But what I'm expecting right now, me personally, is that we might see a little bit of a decrease during the lower season, which for me is the summertime, which is coming up. Of course, it's different in different hemispheres of our globe. But that it would be a small reduction, maybe 10% or something like that. And so that would not make as big of a difference. A second reason that you can see additional waves of cases is that communities put in place interventions for a period of time, and then they use, if they're wise, then they're using that time to build up their systems so they can be able to respond to surges in demand and be able to make sure that the healthcare system is adequately prepared. But then when the distancing measures are lifted, when people are allowed to leave their homes again and go back into workplaces, the virus hasn't gone away. And so you would expect that it would continue to spread. And so then you certainly could see a second wave at that point in time as people are interacting across the network. A third way that you can see an additional wave of cases is if there's a significant mutation in the disease. Right, so certainly scientists are following that for the virus that causes COVID-19. They are not seeing major mutations. Of course, all viruses mutate, but this one is not mutating at a faster rate than others, and perhaps even slower than influenza. But when you look at data from past pandemics, like the flu that went around the world in 1918 and 19, you do see multiple waves, and one of the reasons for that was mutations. So for what I'm expecting for COVID-19, I think of it as not just a second wave, but rather a series of ripples. So I certainly expect that as the interventions are lifted in different communities and in different countries, that we will see an additional wave of cases. And sometimes that wave may be bigger than the first wave. Sometimes it may be smaller than the first wave. Sometimes it may hit a plateau for a little while before it settles back down. It will really depend on the specifics of that country, the specifics of the people, and the specifics of the interventions that are in place. Scientists, think that we'll be in this for a while, where really it will be circulating until there's a vaccine, which could take more than a year. But of course, we do live with viruses every day that are circulating, whether that's a cold, a common cold, or influenza, or even worse, such as HIV. But this one is more deadly than a cold or influenza, and that's one of the concerns with it. And we do need to be careful, and we need to take precautions. But certainly that's something that we need to think about, that this will be around for a while, for a number of months or even years.
Okay, thank you. One last question I got from the group that have logged in today. And I think it's a question that is on several folks' minds, is if, does weather play a role? I know when we talk about influenza and, other kinds of infections like that, that in the summer months, the amount of people getting sick seems to diminish. And so the question is, if weather plays a role, can that to some extent at least account for why the infection rate in Africa, at least in general, seems to be lower than in Europe and than in the US, and what your thoughts might be on that?
Mm-hmm. A great question. Certainly I and others have been looking at the rates of infection in different countries, not only in Africa, but in Southeast Asia, where there's warm weather and very humid weather. In the beginning, it did look like the virus was spreading more slowly to some of those countries. It's difficult to say just from the published data that you see, because that is generally data on people that have been confirmed to have COVID-19, but we expect that there are many more people who are not getting tested and do not know that that's what they have. And not only people who maybe have walked around with it, but there could even be deaths that occur that are not attributed to COVID-19 because there was not testing at that point in time. When you look at the differences between the rates of infection in different countries, one of the other factors is the global travel. So the more connected that a country was to where the initial outbreak occurred in China, then the more likely that they saw initial cases of the disease. And if a country was not quite as connected to that part of the world, then it may have hit more slowly. And then another factor, of course, is that transportation within a country. If you have more rural villages, that you certainly have people traveling by minivan or bicycle or car, but not as much as you have with flights around, say, Europe, for example. Then that can allow the disease to spread more quickly in Europe and more slowly in countries within Africa. The truth is that we don't know yet. And so we're continuing to look for this, but there certainly are a number of countries that have been in their warmer phases, like Singapore, where infection rates have increased as something changes in the contact or pattern of the network. So for example, with the migrants in the dorms. Now, when you talk about weather, there are several different factors too. Of course, there's the temperature and the humidity directly associated with the weather, but there are also factors like whether children are in school in that time period. And when people are in closed inside spaces, then you're more likely to have viruses spread than if they're in outdoor spaces where there's more room for air to move around freely. So that's another aspect that can impact the spread of the disease. And of course, just density, how many people. In general, it tends to spread more quickly and initially in a lot of the urban areas. So I would certainly look towards Cape Town, Johannesburg, and other cities around the continent where I would expect that the disease spread would happen more quickly. And then the other factor is how prepared a country is. Certainly Nigeria and other countries around Africa have had experience in, making sure that Ebola didn't spread further. And so in countries in Asia, some of them learned their lesson from the first SARS virus that came out and were able to respond more quickly. And so you've seen that in South Korea, for example. So there are a lot of factors that go into how much impact there could be in a particular country. Right now, at this point, the bottom line is I wouldn't count on weather being a primary driver. I think some of these other things like density and connectedness are currently playing a bigger role.
All right, I have one last question here. That's a very, very good. Thank you. That's a very comprehensive answer. This one is around, what are your views on the ultimate mortality rate? Do you think, or does the evidence, at least thus far, seem to show that the lockdown is tending to reduce the mortality rate, or do we not know yet?
Yeah, great question. And when we talk about mortality rate, there are a couple of different calculations that are used. And these are used in the media, and it's important to understand which one you're hearing because the rates can be very different. If we knew every single person that had COVID, even if they had a very mild case or they were asymptomatic and didn't show symptoms at all, then I think we would find that the mortality rate tends to be under 1%. So if we had 100 people infected with COVID-19, we might expect that up to one of them would die. Now, we don't really truly know all of the cases with COVID. That's a really hard number to come by in most places. So what we do know is the people who have been confirmed to have COVID. And if they are confirmed to have it, then first they were showing symptoms, and second, they were able to get a test that, and third, that test worked correctly and gave them that information that they were positive and they were counted in some official record. So when we look at the rate of mortality just among that group, people that we know have COVID, the rate is higher. It's 3 to 5% and 8% in some countries. So again, if we had 100 people and we knew that they had COVID because they're showing symptoms and they got tested, then maybe 3 to 8 of those might pass away. Now, the other thing to think about with mortality is that it's not just the mortality from the disease itself, but it also depends on the medical care that someone is able to access. You know, if you saw some of the news reports about Italy, there were time periods when there just weren't enough hospital beds to go around. And if a country is in that situation, then mortality can increase because patients might not be getting the fluids that they need. They might not be getting anti-inflammatory medications, and they might not be able to access a medical ventilator if they need help breathing. So, you know, that can also increase the mortality. And that's one reason that some of these interventions were put in place to try to flatten the peak, as they say, to take what was projected to be the peak demand all at the same time, where lots and lots of people needed hospital beds and ventilators all at the same time, and to push that peak down a little bit so that there are sufficient beds and ventilators to go around for those who are greatest in need. We can also see that mortality can continue to change as doctors learn more and more about the disease. And so, you know, in the early days, there wasn't very much known. Now, you know, there are papers coming out every day and doctors are learning new things, including about new symptoms and what it's doing to the immune system. There are some treatments that are being tried, some antivirals. People are also using the plasma from the blood of people who have previously been infected with COVID-19, and they hope that that will also help people recover. When I think about mortality, the true mortality rate, I look at the countries that have done lots and lots of testing, because those countries are most likely to know those people who are not showing symptoms or have very mild versions of the disease. So one of the countries that was in that situation was South Korea. Germany had also done a lot of testing, and the mortality rate in those places was somewhere between 0.5 and 1%. So again, for every 100 people, you might have up to 1 die. But certainly the rate of deaths that we will see in the news will be much higher than that. And even then, it may be undercounted if people didn't have a test before they passed away, or if they didn't have a test for confirmation after a death.
Okay, thank you. Thanks for that answer. Very good. That's the end of the questions for now.
Okay, great. So now let's talk a little bit about supply chains and what COVID-19 means for supply chains, and what we can learn more generally about thinking about business continuity in the face of major disruptions. And I'm going to use several examples for this next section. And the examples are driven by some things that have been happening in the news with COVID-19. But I hope you'll see with me that they have lessons that go well beyond just the example of COVID-19 on what we can do. And I think, you know, probably most of our audience is aware that supply chains are those systems that connect us all the way on my left-hand side, from the raw materials to the right-hand side, where demand is being met with, and this is individual demand, this is business demand, this is healthcare demand, all of those kinds of things. And it's that whole system in between, the system of suppliers and manufacturers and distributors, and the transportation that's connecting them all the way to the last mile of that supply chain. Now, what we have in many, many businesses is that our supply chains are interconnected. They are global. You can have parts of your supply chain in India and China, and parts of your supply chain in South Africa and Nigeria. And then in addition to this global interconnected system, a lot of supply chains have been optimized for cost and efficiency so that inventory is pushed down to some extent. Certainly, beginning in the 1970s, the Japanese automakers were able to show that you could really get major, major improvements in your system by using a just-in-time system. That does cause some more problems when we start talking about disruptions in supply chain, either disruptions on the demand side or disruptions on the supply side. And that's what we've seen certainly in the specific disruption associated with COVID-19, but also more generally. So there's several different ways that disruptions might impact supply chain. So certainly there can be disruptions in supply. You can see major changes in demand, major increases, major decreases. You might have greater workforce absenteeism because you have people who are sick and out of work. And really for the first time in quite a long time, we've had a lot of shutting down of operations, orders to shelter in place or to have non-essential businesses closed for some period of time. And then there will be the ramp up, the return back to normalcy, where we'll try to get all of our supply chains and businesses up and running again. Now, the good news is that disruption, and this is major disruption, it can lead to innovation. And so we are starting to see that from businesses around the world, and I hope that we continue to see that. So generally, when we talk about supply chain continuity and business continuity, some of the key principles that we're going to talk about in these examples, these stories, is first to know your risks. Secondly, to prioritize which ones are most important for your system. Third is to do things to prevent or mitigate those specific risks. In addition to focusing on those risks themselves, there are also some supply chain principles that we want to keep in mind. I like the framework of the AAA supply chain, where we talk about supply chains that are agile, that can really respond well to changes, supply chains that are adaptable and can retool or reshift as necessary, and supply chains that are aligned, that have multiple entities in the chain working together towards common goals. So here's a COVID example that has been relevant around the world. Certainly in the United States, but also in many, many other places, we've had shortages of masks that are used in medical settings. And so here I have a picture of an N95 mask and a surgical mask. And these are both considered personal protective equipment that are used by healthcare personnel to protect themselves from patients that they may come in contact with who may have some kind of disease. And for diseases like Ebola, of course, the personal protective equipment is much bigger. It has, it might be the full hazmat suit and other kinds of things that go along with that. Now, masks, there are a couple of reasons to wear them. One is for medical personnel, and what we're finding now is that masks may also help protect another person. So if I wear a mask, it might help protect you from any virus that I might have. So that is a reason that in some countries, people are wearing some type of mask, even if it's not the kind that's pictured. Now, we had global shortages of masks beginning in, I think February, just around the world. Now, one thing that's important for this particular supply chain is that a large portion of these items are actually produced in China. And so that's relevant for a couple of reasons here. Because the virus showed up in China first, they had demand, and immediately individuals and organizations and governments started purchasing masks because they anticipated needing more of them. So that depleted the supply from the suppliers that were producing in China. There are also some countries where they have some control over their export system, and so that has reduced the flow of masks. For this particular item, there's a long lead time between when it's produced in a factory and when it actually reaches a store or a healthcare worker, and so that is related to how stable the supply chain is. And within the mask, there's also a specialized material. It's a non-woven that's great at filtering out virus particles. But this non-woven is not made on a sewing machine. It's made with special machines, and it's not made everywhere. And so that's another contributor to the shortages for the masks. So if we think about supply chain continuity, what are the things we see from this? So I start with a basic is that you really need to know your supply chain. So for whatever item you're talking about, whether this is a critical medical item, or this is a supply chain that you're operating for beverages, or a supply chain you're operating for industrial products, you really need to know your supply chain, know who your suppliers are, know where they are located, and really think through a number of different scenarios that might occur. A second aspect is once you know something about your system, then if you can, you might want to try to produce to satisfy local demand for critical products. And this is one thing that has happened with the mask type that's shown on the top right. That's produced, one company that produces that is called 3M. And 3M years ago realized that the mask supply chain was at risk for disruptions. And so they set in place a supply chain that could ramp up masks locally at some of their facilities around the world. And so satisfy African demand with supply from Africa, satisfy Asian demand with supply that's made in Asia, and have flexible capacity to increase in times of disruption. Of course, that has not been enough because the increase in demand goes way beyond just one company in this case. But thinking about that flexibility of that supply chain, the adaptability and agility to be able to respond to changes in demand is really important. And that's something that we can take away, not just for COVID, but for other examples. The next example are the tests that are used for COVID-19. Certainly in my part of the world, some tests for the disease have been difficult to obtain. We had limited supply in the beginning days of the virus spread. And it turns out that one of the reasons for this was that this test, it has several components, and one of the components is a specialized nasal swab. Now, this nasal swab is the best at getting virus samples out from your nose or throat. I haven't had it personally, but that's what I understand. But that specialized nasal swab is also something that is specialized. It's more rare than other kinds of nasal swab. The second kind of test that's come out onto the market that are testing for antibodies are also built on particular chemicals, chemical reagents, and some of those are sourced from the ocean vents that are way underneath, the deep sea ocean vents. And that is an item that you can imagine would be one that is in limited supply. So what do we know about supply chains and components? So in general, we know that product component commonality can be helpful. So if you think about the beverage supply chain and Coca-Cola products, you might have the same kind of packaging used for different kinds of drinks, and then of course they're filled with different drinks and labeled with different drinks, and so that can be good from the standpoint of our inventory and our system. But we do also need to think about the suppliers of each one of those individual items, and if our product is assembled from individual components, we are at risk of being out of stock or not being able to supply that item if we're out of stock of even one of those components. So we have to carefully look at both our bill of materials and the components, as well as the risks associated with each of those individual items. And so that's certainly something that goes well beyond COVID-19. Let me give you another example. I don't know about the grocery store where you live, but where I live, demand really went through the roof for things like hand sanitizer and for toilet paper. Oh my goodness, the amount of money that you could make by selling your toilet paper on the street was just, it was something to behold. I'm just kidding about that, of course. But we did find that toilet paper was out of stock in grocery stores around the country. Now, did the true demand for toilet paper increase? No, the true demand didn't change, but we did have a surge in the demand from consumers who wanted to be sure that they had enough if they might not be able to get back to the grocery store for a while. And there are some contributors to these shortages that we saw around the country. One is certainly if we have lean supply chains that have reduced inventory or just-in-time inventory, and those are generally built on very stable systems where there's some predictability around demand, for example. And the demand, when it went up so high, those systems were not able to respond effectively. A second one is, it turns out this particular product, where I live, there are companies that make the product to be sold to businesses. So it's sold to hospitals and schools and all kinds of other businesses. And there are also companies that make it to sell to individual consumers, households, and through grocery stores. But in general, that production is separate and that distribution is separate. So even though we were out of stock on the grocery store shelves for toilet paper that would go to households, there was plenty of toilet paper sitting in shelves in other places that would go to business channels. So there were really separate channels for these types of demand. So when we think more generally, what can we learn about supply chain continuity and business continuity? One is the importance of having a flexible production system that can respond to disruptions in either supply or demand. And that might be on our machine capacity, on our workers, on other kinds of things. And then the next one is to think about, if we have different channels of distribution, in this case, it was channels for distribution to businesses and consumers, then are there ways that we can make our system more adaptable so that it can use one part of our supply chain to meet demand in the other part of the supply chain? And that is what's happening now, is organizations are retooling a little bit, changing their production a little bit, changing their distribution channels a little bit to better match the supply that is available with the demand in different sectors of the economy. Another example is medical ventilators. On the right-hand side, I have a picture showing one. It's a complicated device that's used to help people breathe in certain medical situations. This is an expensive item. Hospitals generally have some of them, but they don't have a lot of them because they are expensive. And in this case, we had surge demand, and there are certainly cases in the past where that has happened as well. Now, a medical device like this one is generally regulated by governments because they want to make sure that it's safe when it's being used on a patient. Immediately we tried to see if we can we make more ventilators? Can we make more available for the patients who might need them around the world? It's a complicated device. It requires oversight on that regulatory process. And it turns out that there are also critical components of it. And some of these components were manufactured in China, where the factories were not working. So, in terms of supply chain continuity, really understanding our supply chain, understanding those risks, but then even thinking about the design of a product and the design of a supply chain. There is an organization that has created a ventilator that can be used from parts that are currently in existence all around the world and can be obtained fairly easily. And they are partnering with some organizations in Africa to get these ventilators up and running in the system. And so, there's some real lessons there that businesses can take away, and a great example of how the disruption can lead to positive innovation. Another example is food, and we're starting to see some of those shortages not only in the United States, but there are also pointers to this in Africa as well. The specific example that's being talked a lot about in the media right now in some countries is meat that's in short supply. And this is pork, beef, chicken, but then we're also seeing in Africa that there are a number of grain products which are having trouble getting to market. For the meat products, one of the contributors is that the workers at the processing plants are getting sick, and then the plants are having to be shut down for a period of time. For the food markets in Africa, there's the disruption in transportation as there are border closures, or truck drivers are not sure if it's safe to travel. There are markets that are closed, and so you might have a farmer who has grain that's ready and ready to sell it, but it can't get to market, and there's not a market, and so then it can't get ultimately to the consumers who need it. Here, there are a number of different solutions to improve continuity. Certainly, we need to think about our risks in advance and make sure that our workers are properly protected in essential industries like food production. Transportation could also be considered an essential industry. It's certainly important for supply chains, and we have such a global world where imports and exports are connecting different places that that transportation is essential for the movement of those goods across societies. And then mitigate or prevent the risks where possible in that supply chain. There are a couple of other examples that I wanted to provide. There's some early indications that there can be shortages in metals. And so this is in South Africa as the mining operations are reduced or not in operation. There are some pointers to potential shortages that might be coming down the line in medicines based on suppliers that might be in India and who may also not be at full manufacturing capacity. And I think that we will continue to see various examples of this over the coming weeks and months. UNICEF has talked about several challenges in vaccine distribution. It starts from sourcing the product and then the transportation, but then even continuing through the last mile where they've been asked to halt some of their vaccination campaigns. And so, we want to find a way to get that up and running because it's important to protect children against the diseases where we know we can protect them. So I expect to see a increased focus on that coming up. In Africa in particular, there are so many countries that have closed their borders to try to reduce disease spread, but then that does limit the transportation. And that also, in some cases, both the border closures within Africa as well as the border closures in other countries around the world is affecting the export market. And there'll be changes in prices for lots of different commodities. We've already seen a change in price for oil driven by a number of different factors. And what I expect that we'll see is that some businesses and traders will not be able to survive the disruptions. But we will also find some new ways of working that can lead to innovation in business and supply chain. Of course, the risks go beyond COVID-19, which is just one specific thing that would have been difficult to anticipate all the particulars. But supply chains around the world are at risk. So the earthquake in Japan back in 2011, it caused a number of companies to really look carefully at that supply chain. And some of the companies moved very quickly to secure the supply for their critical products that they knew would be affected by the change in output in Japan. So certainly one solution would be to think about inventory, but then also if there's a supply chain that can scale up quickly, it has a lot of agility to respond to those changes, then that can be another solution and one that is used by some companies. Hurricane Maria hit Puerto Rico, the island of Puerto Rico in 2017. And this caused shortages in medical products throughout the United States. So bags for delivering saline and drugs to individuals in hospitals became in short supply. And one of the reasons for it is that the majority of this production was in one location. It was on an island, and this island was at risk for disruptions. So a solution is to think about suppliers, making sure to have multiple suppliers, having suppliers in multiple locations is important. And of course, these are things that I've given a number of other examples down at the bottom that are other types of disruptions that have impacted businesses around the world at different points in time. Now, generally, I think one of the most important things is to start with fully knowing your supply chain and not just knowing who your suppliers are, but know the suppliers of your suppliers. And then thinking about the sourcing strategy. Are these sole sourced? Are they multi-sourced? In what locations are they? And in what potential risks or could you have in those locations? What about your customers? Who are your important customers? And will you be able to get to them in time of need? There's also the information network that underlies our modern supply chains with data centers and voice links between systems and our information technology. And so thinking about that network is also important. Then once you know your risks, you want to understand where the biggest risks are. And so really prioritize which ones are most important. The key suppliers of goods and services. And one question to ask is, if this one were to fail, how would this impact us? And sometimes it's not always the one that you think it is. Certainly this can be driven by the suppliers that are your major suppliers in terms of volume and dollars, but you could have a critical item that's small and not very expensive, but if it's shut down and you don't have another source for it, it shuts down your operations. Trying whenever possible to quantify the probability of disruption or failure. So thinking about past data and forecasting, talking to insurance companies who have a lot of ways of quantifying risks. All of these things are important. And then, really using data and analytics wherever possible, as well as scenario analysis on different things that could occur. And certainly some of the events that are hardest are ones that have very low probabilities of occurring, like a hurricane or a pandemic, but they have high impact with big disruption. And so thinking about how best to plan for those is helpful. And then once you've quantified those risks, trying to choose your suppliers, prevent risk, such as by choosing suppliers, trying to mitigate the risk whenever possible. So look at your sourcing strategies. One key item is to really partner with your suppliers and customers, partner to reduce your continuity gaps and to reduce their continuity gaps, really try to align your supply chain. It's important to have detailed communications plans, and all of this should be done in advance when at all possible, and then tested out and redesigned if necessary. And it's really important to be able to really focus on the potential effect of disruptions and be able to act quickly when there is a disruption. And so this is certainly a number of companies have been able to do this well over the years for different kinds of disruptions. So going back to COVID-19 and wrapping up here, moving forward as businesses and supply chains come back online, one important thing is to protect the workforce. So to do what we can to enable people to work without being in too much close contact with each other, where you might spread the disease through particles in the air or through shared surfaces. And when possible, provide, or when needed, provide personal protective equipment for that workforce. Always important to build relationships and partnerships, like with suppliers and customers, so that, and you build these in peacetime, so that when the crisis comes, you're ready and able to work together easily. And really think about, how do you be prepared for surges up or down in demand or supply? And I think that we will continue to see fluctuations of that over the coming weeks and months. The positive thing is that disruptions can lead to innovation. And so, look for that silver lining when possible, because certainly there will be a lot of challenges towards business continuity. And with that, I'll turn it back to our moderator, Lou Roberts.
Thank you, Julie. Great presentation. We just have a couple of minutes left. So just one quick question from the audience here is around, given what we now know and what we're learning about this pandemic, what key risks should firms be accounting for, looking to include in their supply chain management risk assessments going forward? For example, would be port delays, raw materials availability, those sorts of things. I think both in terms of manufacture and supply of medical products, but also of other important goods and services, including food, gasoline, those kinds of things.
That's right. Yeah, you're absolutely right. And it's not too late to really map out your supply chain and understand, different aspects of your supply chain, and think about those. So if you know that you need metals for your supply chain, then look at where those metals are sourced and think about what would happen if that supply reduced by 10 or 20 or 30% over some period of time. What would be the impact? How could you continue your operations in the best way possible? That's one example. I think that we will see that as factories were out of commission for a while in certain parts of the world, that we will find that some components are out of stock for a period of time. I'm hopeful that many of these factories are coming back online and that we'll start to see more supply come into the market as it has time to get from the factory, on the ships into South Africa or other countries. So, really looking at where are each one of my suppliers, what are each one of the items that I need, either raw materials or components. If I needed to, could I have a substitution? Is there a way to use 3D printing to, make some critical component that I might need, or a part to repair a machine? Is there a way to use that? So it really is quite dependent on the individual company and that individual supply chain. But I certainly encourage businesses to think through what those risks are, as I do expect that we'll continue to see some disruptions in supply of various types across our supply chains.
Thank you so much, Dr. Swann. That was a great presentation, very informative, very interesting, very topical, obviously. And we've had several other questions that have come in, but with your permission, we'll forward them to you and ask you to respond via mail to those folks. And so thank you, everybody, for attending today. And we look forward to seeing you at the next session at GIBS. Thank you very much.
Thank you.